Good morning, good afternoon, and good evening to you all. Welcome to every one of you. Thank you for your great support. To those of us joining live and to those listening in afterwards, welcome to the final episode of the FIP digital programme on the development goals, setting goals for the decade ahead. Today's episode is about development goal number 11, impact and outcomes. And for many, this is the most important goal of all. For us at FIP, measuring impact and outcomes is definitely essential for our profession. For those of you who don't know me, let me introduce myself. I'm Dr. Catherine Duggan. I'm the FIP Chief Executive Officer. I'm very delighted to be here with you today. And I'm delighted that we are reaching the finale, the 21st Development Goal event in the year 2021. A little bit of housekeeping that we want to share with you. This webinar is being recorded and live streamed via YouTube. The recording will be available on our website at www.fip.org. Please ask questions using the question box provided. We have quite a full event today, so we don't know if we will have time to answer them, but the team will answer them afterwards. You're welcome to provide us with feedback to webinars@fip.org. And of course, if you're not already, please become a member of FIP at our membership registration part of the website. So today, it's the finale. It's the finale of our series on the development goals in 2021, the 21st event of the year. And we're delighted that you're with us today. The focus today will be on development goal 11, as I've mentioned, impact and outcomes. We've got a lot of showcasing and a lot of sharing to get through. Let's begin by briefly reminding you of this digital programme, setting goals for the decade ahead. This programme is the FIP 2021 digital programme on the development goals. We launched the 21 development goals on the 21st of September 2020. And this year, we wanted to create a comprehensive outline event series, providing you with coverage of the 21 goals over 21 events in the year 2021. Very neat. The main aim of the 21 digital events is to mobilise global pharmacy development and transformation through the development goals. By engaging our profession, our members and colleagues everywhere, we aim to provide a description, some direction, some support, and some context for each specific goal. Monitoring and evaluating through data evidence and identifying priorities across your practice, science, workforce, and education needs is also part of this programme. You will see the 21 events have run between March and September of this year. That's an average of about 2 events per month, but with a particularly busy September, which coincided with both World Pharmacy Week and World Pharmacist Day, and the first anniversary of the launch of the development goals. All episodes have been delivered, and if you've missed any of them, or this is your first one, please go back and watch as many as you can. They're really, really informative, and they will really help your country and the pharmacists in your country to deliver these global goals together. So today we will describe the FIP development goals and explain the components of DG 11 and the elements of workforce and education, science and practice. We will showcase the FIP tools, evidence and resources to support DG 11 implementation across those 3 elements. We will share examples of member organisations' efforts to progress DG 11, and we will engage our members in an activity to supporting monitoring and evaluation of the goal through data evidence. Before we hear from our speakers, we wanted to quickly remind you of the FIP development goals. They were launched on the 21st of September 2020 as the FIP goals that bring together pharmaceutical practice, science, and workforce and education. As per the vision and mission of FIP, we believe you cannot have pharmaceutical care without a pharmaceutical workforce. But in addition, we cannot have pharmaceutical care without the scientific foundation for the next decade. Colleagues, we know this is important. COVID has shone a light on this. Without science, we cannot have the medicines our patients need. Without education and workforce development, we do not have the workforce that we need. And without the practice developments, we do not have the services that we need. In FIP, we always strive to build on what has gone before. And the FIP development goals are 21 goals that build on the successful 13 workforce development goals that were launched in 2016. Those development goals arose as the Human Resources for Health report indicated that we needed all parts of the health professionals to pull together to deliver the challenges ahead. And FIP rose to that challenge. And in 2020, we used the same consensus-based approach to expand the goals into a set of 21, each reflecting elements of practice, science, workforce, and education. Let's take a few seconds to watch the video that sets the context for those goals in action. We can always post the details of where you can find the FIP DGs in the chat box for you. And today we have two areas of focus. The first area is on Development Goal 11 itself. What is the goal? Which countries have prioritised this goal as important for them and why? How is FIP supporting the implementation in those countries? The second focus of the event is looking at the development goals as a whole. How were the development goals used in one country to set national plans for pharmacy? What has FIP delivered this year and what's upcoming? Now, today for you, a little later, we have got four excellent speakers. We have Mariette Eckstein, who's the Professional Development Officer for the Pharmaceutical Society of South Africa. Mariette is also a global lead for FIP Academic Pharmacy Section, EXCO newsletter editor as well. We have Marianne Sanfournier, President of the Malta Chamber of Pharmacists. We have Judilyn Solidum, who is the FIP Global Lead for Development Goal 11 from the Philippines. And we have Jack Shen Lim, who's the Treasurer of the Malaysian Pharmacist Society. When the time comes, we'll share their biographies in the chat box, and we will be hearing from our colleagues in due course. Right now, though, I'm going to hand over to my colleague, Lina Barra, known to all of you, to describe the development goal number 11. Over to you. The floor is yours, Lina.
Thank you very much, Catherine. Very briefly, before we delve a little bit deeper into DG 11 and how it's being implemented across the world, just a quick reminder of what this DG is really about. So obviously on screen you see we've some translations of the goal icon, but we'd like to run through the elements with you. So as with the other 20 goals, all 21 goals come with three elements: workforce and education, practice, and science. The workforce and education element of this goal aims to have global evidence of the impact of the pharmaceutical workforce within health systems and health improvement. It comes with a set of mechanisms, this element, mainly including engagement with systems to measure the impact of the workforce on health improvement and outcomes, including links with needs-based education, training, and workforce planning. Gathering continuous data points to monitor the performance of the workforce, and ideally this should all be linked with strategies to enhance workforce intelligence as well. We do have a workforce reference guide at FIP that sums up the different kind of resources we have that supports implementation of the goal, and you can find the workforce reference guide through the URL link you can see on the screen. And we'll tell you more about some of these shortly. The practice element of DG11 is all about achieving evidence or obtaining evidence of the impact of pharmaceutical services in terms of health outcomes, as well as quality of life, improved efficiency of health system, and sustainability. A number of mechanisms come with this element to support its implementation. I'll just briefly highlight a couple of them. One is recognizing and taking accountability for the societal impact of our services as pharmacists in terms of health outcomes, implementing systems to measure and monitor service impact and outcomes that are based on agreed definitions and standards, enabling and promoting practice-based research, health impact assessment and evaluation mechanisms that also facilitate practitioner-led evidence generation. Implementing systems to measure cost effectiveness, including analysis, cost-benefit analysis, utility analysis, and budgetary impact of professional services. Promoting the transparent and rigorous exchange of impact assessment data to inform practice development and policy. Last but not least, the science element of this goal aims to see that we have globally strategies and programs in place to enable timely access to safe, effective, and affordable medical products. Again, a number of mechanisms are accompanying this element to support its implementation, including monitoring and reporting on the positive and negative consequences of new medical products, the use of transparent evaluation processes to establish the value of these outcomes, and promoting scientific research to continuously improve patient care using technologies. Finally, disseminating the contributions of pharmaceutical sciences that underpin successes in discovery, development, and utilization of drugs. That was just a brief summary, and of course you'll see here the linkages across these three elements. They are quite interlinked, and we will describe later on how a new framework FIP is developing really brings these three elements together. This goal, same with the other goals, interact and rely on a number of other goals. Some of them include equity and equality, quality assurance, advancing integrated services, medicines expertise, and access to medicines, and of course, pharmacy intelligence, which is very much integrated in the mechanisms of this goal. I'm handing over to Catherine again. Thank you for that, and I hope that was a helpful summary. And you can see in the chat box a link to this goal to find out more. Thank you.
Thanks, Lena. Super helpful. So, colleagues, earlier this year at the World Health Assembly, WHO announced an initiative to create some resources, some learnings from member states for being more prepared for the next pandemic. Now, actually, I must say, none of us knew at that point that we would be facing some of the biggest challenges yet at this time, week 50 in year 2021. However, to be prepared for what we have to face, as well as other pandemics, it's important we take some learnings. Now, we don't know how FIP will be inputting into that because it's mainly about member states, but we do know that the NGOs that work in partnership with WHO need to prepare learnings for their own professions. So our work on pandemic preparedness really fits with goal number 21, sustainability pharmacy. It really helps us to understand how we're going to build not only the professional capability, but the workforce as well. And what we're doing as a two-staged approach is firstly, taking from January to the 30th, 2020, every 100 days, we will be visualizing and documenting all of the work that FIP has collated from you and creating a map, if you like, a timeline of what has been done and how the profession responded to the pandemic. We feel that understanding how we responded and what went really well is a very positive way to showcase to the profession what it has done in a sterling response to the pandemic. We will do that for the 1,000 days of the pandemic up until October 2022. And we have predicted that 1,000 days is really as long as it will take for us to have some learnings on this. It may take longer, colleagues, but we will be in a position with learning at that point. So we will publish not only the timeline and the learnings, but also a short report on what could be done better, what we could do differently, what learnings we could share with each other at different points in time. Were there any things that went particularly well in certain countries that others could learn from, and so forth. We think that this will be a useful report for our profession. It will feed into the WHO pandemic preparedness report, and it's a way in which we can showcase our impact and effectiveness to health ministers globally. And in parallel to this work, we were invited by the Economist intelligence to take part in developing a toolkit earlier this year. We were the only health profession involved in that. They were focusing on some country studies, which around spring of 2020, they had evaluated, had done well in the pandemic. Then when we revisited this in August, some other countries were found to have done well at that point, and perhaps the countries who'd first responded well had faced other challenges as well. So it was an interesting experiment, and FIP was front and centre in this. And then we took part in a session at the World Health Summit. You can see, we can share with you the link to that, and the report has been published from the Economist intelligence. I mentioned to you, colleagues, we'll be creating a report, learning from what has worked in the pandemic, and our report will also reference this response toolkit. We can see what has positively impacted us, the fact that we can influence policymakers, the fact that we have trusted in our populations, the fact that we have offered evidence-based advice all the way through. So we'll use this toolkit as an anchor point for our profession. I must say it's a very proud moment to be able to present on behalf of the profession at such an eminent summit, especially when we are the health profession that they have chosen. I would also say their country level reviews are very worth looking at. They took countries and looked at them at various time points and then coming up with models that we could all benefit from. And as I mentioned, we will learn from that and we will link our work to that. And then we will hopefully have some of those colleagues at some events next year. So, colleagues, in summary, what were the lessons we learnt in the pandemic? Well, it shouldn't come as any surprise to you that colleagues that were able to collaborate really did better than those who weren't. We also needed to showcase and share expertise and access to expertise. Next click, please. Had to ensure equitable access to not just the medicines that patients were relying on, but also tests. And, what about the vaccines? We need to keep pushing for that. Trust with the public was a huge issue that pharmacy was front and centre with. We also found that working interprofessionally was of benefit rather than competing or having tribes of professions. Making pharmacists integral to the healthcare team and systems really helped. And also having science-led policy making was a real lesson. We can see that even now with the Omicron variant. The next steps then, involvement and any contribution to any project upcoming within FIP should potentially align with this work. Contribution to our Unitwin programme and the regional centres of excellence. contributions to our specialist interest group in practice research? What about the impact research methods framework? How can we use that? And then we've got some work on models for forecasting the impact. In addition, using some external data from OECD, we can actually extract impact analyses and impact assessments. And when we think about DG11, it's always worth others present the data so that we can take some in this. Next slide, please. So without further ado, I would like to hand over to our speakers of today. And we have Mariette Eckstein, who is a Professional Development Officer at the Pharmaceutical Society of South Africa. Mariette is also a global lead for FIP and is on the FIP academic pharmacy section and is the EXCO newsletter editor for FIP. Mariette, the floor is yours.
Well, good afternoon, good morning, and good evening, Catherine, and everybody that's joined us for this program finale this afternoon. Thank you very much for the opportunity and also for the kind introduction, Catherine. Colleagues, it's a privilege for me to present on the need for impact and outcome in the South African context. So just as a brief background so that you understand where I'm coming from this afternoon is that the South African Pharmaceutical Society of South Africa is the largest voluntary professional association for the pharmacy workforce in the country. And our members includes from all sectors of the profession, so academy, community pharmacy, hospital pharmacy, and the industry, as well as all geographical areas of the country. What is important in terms of the member benefits that we have as PSSA is that we promote the irreplaceable role of the pharmacist as part of the healthcare team to other healthcare professionals and to the public, and that we also negotiate on behalf of our members with government, whether that is the National Department of Health, Head of Pharmaceutical Services, or the Minister of Health, or other health related professional councils, such as the South African Pharmacy Council, the South African Health Products Regulatory Authority, etc. However, we do have a problem in fulfilling this mandate, and that is what evidence or data do we have to prove our advocacy work? So I'm going to highlight just a few areas that we currently experience a difficulty in proving our impact. So if we just look at the field of remuneration, and I'm sure everybody can agree that that's always a difficult area to work in and to prove your impact. In 2019, we did an investigation, and that pointed out that an entry-level pharmacist, meaning it's a grade 1 pharmacist, first year of professional work, post-community service, receives more remuneration than a pharmacist with a PhD and 10 years experience in the area of academia. So in other words, how do we approach the process of proving the impact of an academic pharmacist? Another area is the dispensing fee for community pharmacies. So the 2021 fee was published for comments recently, but the proposed fee indicates a less than 2% increase in the professional fee for a pharmacist. And this has been the case for many years. So how do we prove the role of the pharmacist when it comes to remuneration? In terms of the clinical practice setting, it's very important that we have evidence of the impact of the pharmaceutical workforce within the health systems and in terms of health improvement. We also need evidence of the impact of pharmaceutical services in terms of health outcome and the quality of life, improved efficacy of health systems, as well as sustainability. And here I'm thinking about, let's envision universal health coverage and the role of the pharmacist in a system such as national health insurance. This is now a critical time for us to ensure we can prove our impact in a clinical setting. Recently, South Africa has embarked on a process where we wanted, or where we are in the process of establishing an additional role for pharmacists, and this is called Pharmacist-Initiated Management of Antiretroviral Therapy, or PIMART, as we want to call it. And South Africa had difficulty to roll this out, although it was already published for implementation. A lot of other healthcare professionals objected to this role, as they say, we can't prove that we as pharmacists can take a patient history, can consult with patients, can diagnose anything, not yet even to say that we can initiate therapy. So colleagues, although all of these competencies are included in our competency framework for pharmacists, yet we need that evidence to prove the impact that we have. So with this said, I want to say thank you, FIP, because based on some of the publications that FIP is publishing, we as PSSA can utilize this, the data, the statistics, and the evidence for the advocacy work that we do. So for instance, the first image is on the non-communicable diseases report, and South Africa were able to use the content of this report when we commented on the Department of Health's policy on non-communicable diseases for South Africa, which, by the way, no pharmacist was included in. So what is our plan of action? Our plan is that we must urgently initiate research projects, and the focus will be the role of the pharmacist, or the impact of the pharmacist in a South African context. So we did embark on this already in 2020, where we commenced with a broad research project to determine the areas where pharmacists can make an impact. And from this analysis, we would like to approach different universities or research entities to select certain research focus areas and then to promote research in those areas. The broader inclusion of research is also important because as part of the B.Pharm degree, as well as the postgraduate internship, both students and interns have to conduct a research project successfully in order to meet the requirements of completion. So again, this is two ideal opportunities that we can use to focus the research on the impact or the role of the pharmacist and to get these studies published. We also need to compile, while we're at it, a list of research topics that when there's a need for research, or which we can also distribute to postgraduate students to give them some ideas of research topics that needs to be researched. And this may commence initially with a case study, but then also longitudinal studies for longer terms will be valuable to prove that impact. South Africa also have a South African Pharmaceutical Journal, but we don't currently have a lot of peer-reviewed articles in this publication because the focus is really much more on the practicing pharmacist. So as a result, South Africa and the PSSA will launch an SAPJ research journal, which will be a research peer-reviewed scientific publication. And we will aim to create a local platform for publications of South African research content. Colleagues, in conclusion, I would like to conclude with a quote that my colleague, Dr. Shah Moodley, used a week ago in the 20th episode of this program, when they focused on Development Goal 15, which is medicines experts. And I quote his words: "The next decade will require us to combine our medicines expertise with understanding impact. The future of medicine expertise require us to develop quality measures." So it is critical for us to record what we do, to collaborate on what we do, to showcase on what we do, and lastly, to publish what we do. So don't wait another day. Let's act. Thank you, colleagues. Thank you, Catherine. Back to you.
Always an inspiration, Mariette. And I think I must just say that this kind of model of sharing, showcasing, disseminating and publishing is something that FIP is really proud to do. There's one lesson to be learned, that evidence from one country may help another country to accelerate. So let's share those reports as much as we can. Without further ado, then, I'm going to welcome the second speaker that we have in our entourage today, Marianne Sanfonier, the president of the Malta Chamber of Pharmacists. The floor is yours, Marianne. Welcome.
Thank you, Catherine. I must say that I was very inspired both by your presentation and by Mariette's. Very interesting. Can you see me? Can you hear me and see me? Yeah, okay. All right, so I'm going to move my slides. Let's see how that goes. So I was invited to discuss the DG11, Impact and Outcomes, within the context of the Malta Chamber of Pharmacists' key priority areas, or rather I considered that it would be the best way to go about it. So like what we're doing on the ground and how we can see how we envisage the DGs. In fact, most of them are important and have spearheaded, for example, by the development goals as we followed them in the excellent DG digital events held by FIP. And we believe that they are fundamental to the pharmacy practice, especially transformation in Malta. So, of course, we are looking at the emphasis that is being made by FIP of the three pillars, the three elements of practice, science, and workforce education. And we have chosen 4 of our high priorities in the scenario of community pharmacists. The Chamber is not-for-profit professional organization and union also. And the majority of its members are community pharmacy practitioners. And also we have a number of members who come from other different areas of practice, but we have a big focus on community pharmacy. So the priority areas are pharmacist-led life course vaccination, including, of course, the developments with COVID, the vaccines in community pharmacy. Pharmacist repeat prescriber and emergency prescribing, leading to full pharmacist prescribing role. This is a development during 2020 with the repeat prescribing, for example, due, of course, to the COVID-19 pandemic, but I'll explain this later on. Medicines use reviews and collaborative medicines management. This is a very interesting development. We have also been inspired by one of the digital events that was held by FIP, but we have been working on this for some time, and I will also be referring to that separately. And then because we want pharmacy to move away, not depend only on the dispensing of medicines, although it is a core role, of course, and is very important, but we want to develop further point-of-care services and other remunerated clinical care services. So those are the 4, if you want cases, if you want case presentations that I would like to talk about in the context of the DG11. I'm afraid that the text here is a bit, is rather small, there's so much text there, but I will tell you in a gist what it is. So, basing on the fact that we have to keep in mind that the impact and outcome of pharmacist-led vaccination remains a priority for us, we have, let's say, divided the significance of what we're doing at the moment basing on the pillars. So the workforce education first. There is no priority here in the 3 pillars. So we worked on the workforce and education development, especially this year during September. We also had a very strong FIP presence there, and I thank you for that. Catherine, you were there, and we asked you to explain the FIP development goals philosophy. And we have presented even elsewhere and even in this context with the FIP events, the work that the Chamber has done with regards to training and upskilling the pharmacists in vaccination, immunology, etc., and also vaccination competencies. We talked of collaboration, and my colleagues have talked of collaboration, and we have been very happy to see the interest that we generated, and we had a lot of collaboration from different, inter and intra-professionally. We are not, I must emphasize that throughout this presentation, we are not at the stage of measurement. So I mean, at the moment, I cannot present a methodology for impact and outcomes. However, we are conscious of the importance, of course, of measurement. So as you can report back, especially since we have a role of negotiating, like our colleague from South Africa, negotiating with government for roles, remuneration, etc. So there is a plan, of course, to retain data. At the moment, the data we have is qualitative, and on numbers, for example, of interest in the course. For example, we're already covering the whole network of community pharmacy with interest, and we have the first cohort of more than 120 pharmacists who are upskilled with regards to certification, for example, by the European Resuscitation Council with regards to the hands-on support training for vaccination administration. From a scientific aspect, exactly, one has to put in place the systems so that we can measure the impact of pharmacists in the community leading vaccination, life course vaccination, with an impact on health, better quality of life, better sustenance of the national campaigns that government initiates from time to time, and the role in AMR. So I think in a gist, that is what I can say with regards to impact on and outcomes with regards to the priority of the Chamber to set up and maintain pharmacist-led vaccination, which we hope is something that can be implemented soon. At the moment, we are looking for training placements in conjunction with the National Health. We are in discussion, and we're also working on the scenarios, which we will then, that is when we will have to have results in order to be able to discuss. Okay, I lost, hello? I lost the...
We can still hear you, Marianne. The next slide is up.
I'm seeing a survey. A survey came in. I'm not seeing my screen anymore. Okay, just a minute. I'm sorry about that. An FIP survey screen came in. Okay, so this is the next slide. And this is a very interesting outcome that is, I think we can say that, if I may, if you will allow me, I will say it was impacted by the COVID-19 pandemic developments in practice. It started with wanting to go paperless, and even being approached, this is within the National Health System scheme, what we call the Pharmacy of Your Choice scheme. And we were approached by the psychiatric community services, the clinical chair, etc. So the psychiatrist came to us and wanted us also to be able to prescribe and dispense repeat prescriptions to patients who are on narcotic and psychotropic medication on the basis of web-based system that we work on. So there is a digital platform, and we are working within the, how should I say, within the safety, if you want, and the information of that platform. We still, of course, haven't arrived at the stage where we can measure, but this is a protocol-driven practice development, and we see it as the seed that has been planted in order to implement legislation and practice on emergency prescribing, which do not have emergency prescribing initiated by the patient now. And our final goal would be to have full-blown pharmacist prescribers. We have the support of our National Competent Authority, which is the Medicines Authority, and we are working with collaborative models with the policymakers, and as you saw, also with clinicians. But we intend also to overcome barriers to work with the, for example, family doctors. Again, however, we do have a digital platform, and we intend to use that in order to measure trends, for example, and outcomes. So, as I said, I'm not at a stage where I can report results, but from a qualitative aspect, the protocol is being implemented. Many family doctors and consultants are cooperating. Patients are happy. What we need to fine-tune, and I'm in discussion with even some other national pharmacy organization in Europe and elsewhere, in order to establish a better structure, for example, for referrals and for record keeping and documentation. So this is something that we are happy about, and I hope to be able to report on impact and outcomes later on. With regards to this process of the POIC contract and the MURs. The MURs have been on the table for some time, and we have managed to, we are at the final stages of negotiation at the moment of the new National Health Scheme contract for the next 5 years. Within this, we are introducing the service of the medicines use reviews adapted to our needs and system, and what we call collaborative medicines or pharmacotherapeutic management. This is also will be protocol driven and based on patients who are entitled to the service within the National Health Scheme. But we are also looking to see how we can look after patients who, the revolving door, like people going to hospital and coming back into the community. And so we want to see the development of seamless care. And also to work, as I said before, with the triangle, doctor, pharmacist, and patient, and maybe other healthcare professionals on a system of referrals, and to establish a good record keeping and reporting into the national system. There's a lot of data generated with regards to this web-based system of the POIC. And unfortunately, this data is still not being utilized scientifically in order to develop practice and for better health outcomes. So about trends, prescribing patterns, pharmacist intervention, where we encourage the pharmacists to record their interventions. But we think that with the division of the developmental goals, and especially of DG11, and the tools that FIP provides, we'll be in a position to collaborate with you or some of you, or those who are interested, in order to be able to actually measure, report, and use that information for the betterment of pharmacy practice. Finally, another priority for us is, as I said, to look at the role of the pharmacist in community, to be more involved in point of care services. We do have, for example, this year during the pandemic, there was the development of the COVID-19 rapid antigen testing guidelines, which were implemented, and we were working very closely with the Superintendency of Public Health, with the people from infection control, with the industry, and also with others. And I can say that there is a very good reception of what the pharmacists are doing in this regard. And they're also reporting to the national system, and it's integrated into the whole system of point of care diagnostics and screening. And then, of course, there is signposting. But there is a traditional development in well-established diabetes care management, for example, and cholesterol, etc. And we would like to consolidate more a pharmaceutical care service. We have some indications and some studies that have been held. We also ourselves have worked in this field on also a priority in this country, which is childhood obesity. And then, later early onset of type 2 diabetes, for example, in young children, and then a development into adults. And so there are studies going on, and we are trying to find our place so that we can actually present robust data that we can use to show the value of the pharmacist in the community in non-communicable diseases. The future, which beckons, is the development of and implementation of pharmacogenomic testing with the developments of personalized medicine, for example. But it is also something that we would look to, but there are other things at the moment which are taking our time up, especially with the, for example, conclusion of the negotiations and introductions of the MURs, where we have some time and motion studies done already, but we have to consolidate all these. I hope that in future we could be able to come here and present details. I think that is, in conclusion, I'm ready to answer questions, but I presented 4 of the major priorities in Malta for pharmacy practice based on the pillars that are being promoted by the developmental goals, which is science, workforce development, which I forgot to mention, for example, in the context of vaccination, is that we've participated in the opinion spearheaded by PGEU and a number of other European organizations with regards to the changes to the pharmacy workforce competencies and the directive referring to the professional qualifications. And for example, we recommended vaccination, immunology, vaccination competency, and many, many other interesting points which would come under the title of the needs of the workforce and education within the developmental goals pillars, together with science and the development of practice. Thank you.
Thank you so much, Marianne. And I think some of the most valuable parts of the comprehensive presentation is really that we can all learn along the way. We don't just have to wait till we have evidence of impact. We need to understand how to set the scene and to create the environment to collect the data. So thank you so much for that, Marianne. We will definitely be having you back to tell us more about the Malta story. Our third speaker in the session then is Judilyn Solidum. She is the FIP Global Lead for this development goal based in the Philippines. And I believe we have a recorded video from Judilyn. So over to you.
Great day, everyone. I'm Judy, and I will be presenting the proposed framework of DG 11. Okay, so let me just share my screen with you. Okay, so let me just do the slideshow. All right, so this is the DG 11 proposed framework with the goals. First, engage with systems to measure the impact of pharmaceutical workforce on health improvement and health outcomes. And these are anchored on needs-based education, training, and workforce planning. Second is to gather, measure, monitor, and evaluate continuous data points to monitor the performance of pharmaceutical workforce. And then last is to link two strategies to enhance workforce intelligence. This goals emanated from FIP. This is how the proposed framework looks like. This would be the components. We have first the measurement of pharmaceutical workforce or PW, service delivery, followed by pharmaceutical stakeholders or PS, evaluation and monitoring of PW impact, and then we have collaboration between PS and PW for continuous improvement, and then we have the health system outcomes. We also have in the team identified areas which we call work in progress, because these areas are dynamic since there is continuous flow, then there's development, evaluation, and refinement. Okay, so first we have as part of something that is always in progress, we have the data flow where data will be shared to link and to add strategies to enhance PW intelligence. And then we have transformative education, followed by continuous improvement, and then the knowledge or pharmacy performance indicators, or what we call KPI or PPIs. Okay, so the PW impact will have non-communicable diseases as focal point to jumpstart its activities, focusing on the prevention and safety. Okay, so this shall be extended, however, through time to include communicable diseases. Now, this will be the details of the framework. So the framework has 4 layers. So please take note of the pink arrows that will be appearing in front of you. So the outermost layer denotes the flow of data throughout pharmaceutical workforce impact measurement framework. And this data will actually fuel practice and build science. The third layer from the innermost circle is involved in the different processes and outcome. This layer of the framework has 4 curved and colored parts, namely. So the arrow that pointed to the third layer from the innermost circle actually is the first curved portion. Okay, so it's royal blue, and it's measures of service delivery within the pharmaceutical workforce. This will include all pharmacy professionals in the different pharmacy settings. Okay, and this PW service delivery measures enable judgment on progress, and this needs to be aligned to outcomes. And process measures assess how well or how reliably a service is being delivered, and the outcome measures assess how close we are to achieving the intended goals. Now, according to Dugan in 2019, PW will be better able to advance science and practice through transformative education and training system. Okay, so actually this is on the next level still, but let me discuss it just the same. So this is to provide better health care. Transformative education and training system hence catalyzes better delivery of the measures embodied in the scope of the pharmacy practice, as shown in the bubbled arrow below that of PW service delivery measures. Now, how the impact of PW will be measured is anchored on the scope of pharmacy practice, that of health communication, quality medicine supplies, supervision, and collaboration, to being direct health promoters. Okay, so the scope is true for all pharmacy settings, hence was set the generic value of this framework. The actual assessment forms on knowledge or pharmacy performance indicators, which is actually in the core. They are, however, not identified as of yet, since PWDG 11 is still finalizing this generic framework. But the PPIs, or the pharmacy performance indicators and knowledge performance indicators, will be developed as soon as this framework, this proposed framework, is approved. Okay, so the light blue area will be for monitoring and evaluation by pharmaceutical stakeholders, including health organizations, health think tanks, professional representative bodies, organizations and health-related professionals, health system colleagues, patients and patient groups, and health policy makers. Then we have the blue-gray area, which would show collaboration between PS and PW through feedback response mechanism, and this will contribute to continuous improvement of the processes. The feedback protocol, which started in the monitoring and evaluation, will continue toward the refinement of service delivery and the development and refinement of measuring tools that have KPIs and PPIs. Right, so the outcomes are the benefits that are delivered as a result of service. Now, for PWDG 11, we have health system outcome. And health system, we are following in the theme, the definition of WHO in 2020 of what health system is. And in 2021, still according to WHO, a well-functioning health system is one with trained and motivated health workers, well-maintained infrastructure, reliable supply of medicines and technologies, adequate funding, strong health plans, and evidence-based policies. Now, according to Mireille and Frank, it is the goal of the health system to improve the health of the population, be responsive by giving respect to persons and being client-oriented, and have fair financing and financial risk protection for households. This will be measured as health system outcomes. So the second layer from the innermost circle consists of bubbled arrows to denote the direction of the processes within the framework. There are three of these bubbled arrows, namely process and outcome measures, the scope of pharmacy bounded by transformative education, and training system. Well, something that was discussed together with pharmaceutical service delivery measures. That's the reason why it sounds familiar. And then second would be estimating, planning, monitoring, and evaluating impact. And this was called FirmSo and Staskevicius in 2015. It's a business model framework that they have prepared or crafted, but was adapted to the pharmaceutical workforce framework. Okay. Quality programs must have input and feedback from staff and clients, and there should be planning, organization, and monitoring as well. With this, there is assurance that the processes within the PWDG 11 will be of quality. Now, in the foreword of the article of Bates et al. In 2018, William N. Charman mentioned that workforce intelligence provides the strategic analysis and information to support health workforce planning to achieve universal health coverage, or UHC. Workforce intelligence gives strategic evidence to support workforce planning. It may also be used in assessing the performance of the workforce. This bubbled arrow on monitoring and evaluation and continuous improvement suggests sharing data with proper entities, agencies or stakeholders, PW groups like FIP, PWDG 12, 13, and 10. Now, PW intelligence may be enhanced with data sharing, and strategies on collaborative work between PW impact and intelligence will be formulated and strengthened by projects related to it. In data sharing, there will be observation of the progress or quality of activities on an ongoing basis, that is monitoring, and determination of the worth and significance of an intervention, which is part of evaluation. Impact is the focus in this particular level, and evaluation is a systematic approach of gathering and analyzing information to enable judgment regarding the impact in relation to measures. Now, for continuous improvement, okay, next pink arrow. It is said that in quality programs, continuous improvement is important to achieve optimal outcome. Hence, the last bubbled arrow is understood to lock the loop of the framework back to outcomes. Continuous improvement relies on data to inform and drive it, and is relevant because it helps to enhance the effectiveness or efficiency of services. It is on this level that continued refinement of protocols happen to better improve the delivery of measures, hence the outcome. The innermost circle, which was already touched a while back, is about knowledge of or pharmacy performance indicators, or KPI or PPI, whichever is applicable. Then all processes in the bubbled arrows of the framework will be guided by FIP developed KPIs and PPIs. Now, the data flow continuously as one moves along the framework, and this will actually again fuel science and practice. The entire framework must be jointly owned by all stakeholders of PW for strengthening to occur. Okay, so in the next steps, after hopefully having this proposed framework approved finally, we would want to do some data mining on the service needs on different tiers. Okay, local, regional, national, international, and see how these are being met by the services provided by PW. Results will be to allow recommendations for improvement of competencies in service provision and practitioner development, as well as suggestion for enhancement of educational development, infrastructure, and quality. Now, data will be gathered from the levels of authority, provider representatives, and service providers. And this will aid in the development of tools for regular monitoring and evaluation of PW service delivery measurements. This follows the model from FIP needs-based development. And the second thing that we want to do after this framework has been approved would still be to data mine to respond to health systems goals according to WHO, that of improvement of health of the population. For instance, looking into the issue on appropriate size, distribution, and composition of PW in local, regional, national, and international tiers to assess PW service delivery on communication that may translate to either improved or regressed health of the population. The idea or the concept came from the paper of Anand in 2011. And then data mine as far as responsiveness is concerned, as well as a fair financing and financial risk protection for households. And this will be the references that we have used for this proposed framework of DG 11. Thank you very much for listening.
Thanks so much to Dudalyn for her recorded video there. Really, really interesting. And without further ado, it's really important that I welcome my colleague, Chris John. Chris John is the FIP lead for data and intelligence, so no better person to tell us about the indicators. The floor is yours, Chris.
Thank you very much, Catherine, and hello, everyone. This section of today's event is about monitoring and evaluating Development Goal 11. We have an exciting activity for you, which we hope you will find very interesting, and I will introduce that to you very shortly. I think we've heard from all the speakers today the importance of data, and we've said this at all the Development Goal events, how important data is, but it seems particularly important for this development goal. And I think the speakers have made the case very elegantly that we need to move beyond the output, so things like the number of pharmacists we are producing, the number of services we are delivering, the number of new medicines we are producing. And we need to move to outcomes and impact, which is vitally important and is tricky, but certainly doable. So the FIP Global Pharmaceutical Observatory is in full operation, and its mission centers around data, intelligence, advocacy, and reporting. So I've said how important data is, and for data to provide us with evidence, and for evidence to provide us with intelligence. So our first task is always to collate valid global data on workforce, education, practice, and pharmaceutical science. We must undertake comprehensive analyses of collated data to provide accessible, high-quality intelligence. And all this must be communicated innovatively to promote our member organisations' impact on health. This communication will often be via the FIP Atlas, which is our visualization platform for displaying our intelligence across the globe. And finally, we must provide evidence-based strategic information reports and guidance on the application of pharmaceutical science, policies, practices, and services. You'll see on the next slide, FIP, I've just jumped a little there. Let's just go back a bit. You'll see here are the FIP GPO outputs and inferences. We have been working with our Data and Intelligence Commission on what success looks like for the GPO in about 18 months and 5 years' time. And that's really useful because we will develop our own impact and outcome measures for the GPO. But our main outputs and influences at the moment are sharing and disseminating intelligence that informs policy formation and advocates for the profession. We will be country level monitoring, reporting and information comparisons. We will have research and analysis, evaluation of trends to support action planning. We will be facilitating collaborative working and national and transnational networking, and we've been doing this in one of our big projects, which is called METNA, which I'll mention briefly in a moment. We will be doing evidence generation for capacity building and provide potential for linkages with other observatories, such as those already in establishment by the WHO and OECD. The main reason why I'm here talking to you today, though, is that health system strengthening by tracking progress against development goals is important, and particularly this development goal 11. So current GPO actions and projects, I mentioned this METNA project, Multinational Education and Training Needs Assessment. We've been completing a project with a cohort of nations and mapping their education and workforce needs assessment using the FIP development goals as a framing device. I mentioned the Atlas dashboards, which is our online visualization platform. And we've also been building a GPO microsite and database. And all of this has been, we've been having helpful advice from the Data Intelligence Commission, who meets every quarter and give us some great strategic direction for our work. And finally, and the reason why we are here today, we have an important project that aims to produce indicators that will measure and monitor progress towards the development goals. We've been doing this, as I mentioned, in each development goal event. We have been talking through what is the data we might need, how can we measure progress, what indicators will show us what progress is being made. So this is where you all come in. We have a short engagement activity for you. FIP is now seeking to develop indicators and country level metrics to measure and monitor progress and the performance of the implementation of the FIP development goals. And today it's development goal 11. So during this event, we would like to seek your support for this global indicators and metrics project by contributing to this brief activity linked to the current event. We'd like you to know your opinions about how this development goal 11 can be monitored and measured. So if you click on the link on the slide on the screen now, or scan the QR code, that will take you to a short activity. We'd be very grateful if you could undertake it during the event. If you're not able to undertake it during the event, we will be sending you an email with these links in as well. But your help and expertise engaging with this activity will really help us in developing indicators and metrics to measure and monitor progress with implementation of development goal 11. I'll also copy and paste a link into the chat box. But that's all I had for you today. So thank you very much. And I will hand back to Catherine.
Thanks so much, Chris. Really flows seamlessly, this whole idea about measuring indicators and assessing impact. Now, it gives me great pleasure to introduce our last speaker today to walk us through how the Malaysian Pharmacist Society, one of our member organisations, has used the FIP development goals to map their internal chapters, priorities, and to align actions. And we think this is a very good example of how to do that, much like our other speakers. Maybe there are lessons you can learn in your member organisation, and we would be delighted to support you with that. So without further ado, I'd like to hand you to Jack Shen Lim, who's the treasurer of the Malaysian Pharmacist Society. Jack, the floor is yours.
Thank you, Catherine. Okay, good morning, good afternoon, and good evening, my fellow colleagues. Salam sejahtera from Malaysia. I'm very happy to be here to share with you guys, all my colleagues, on how we have used the FIP development goals to positively impact the direction of the society as the member organization as a whole. Our society is called the Malaysian Pharmacist Society, we'll call it MPS. Okay, but just to highlight to you, we need to actually start where we come from to where we are going. So if you look at the slide, this is actually a map of Malaysia, and it actually shows the Malaysian Pharmaceutical Society across all of the 14 states and territories of Malaysia. Historically, there is a difference between our Borneo states and the states on the peninsula, which is on your left. So we have association members that are independent associations that are part of us. And then we have area committees geographically that's scattered across the states on the left side, which is the peninsula. We also have a very active young pharmacist group, which is actually called the Young Pharmacist Chapter. So basically, this is actually where we are geographically. Okay, so moving on. So this really complicated slide with a lot of squares actually shows all the chapters and committees that the MPS has. And why is this significant is because while we have a council that's elected by all members, and we have a secretariat that supports the direction and activity of the council and the society as a whole, generally, since its founding, the people that are most active and contribute the most and bring the most success to society are the MPS chapters. And these chapters are basically like-minded individuals. It could be, we have a community pharmacist chapter, we have an industrial pharmacist chapter, where this area of practice is there. We also have a compounding chapter, for example, looking at compounding. And we also now have a technology chapter to look at digital technology, and so on and so forth. So basically, areas of interest, areas of practice, or even, for example, the young pharmacists, where we are encouraging the young pharmacists of today to be leaders of tomorrow. So basically, this is where we are. And all this while, since the 50-odd years that MPS has been established and present in Malaysia, it is generally determined quite independently by the chapter heads. And that's the reason why we decided to move slightly away from that model, thanks to the FIP development goals. Okay, so there is a saying that goes that you cannot build a great building with a weak foundation. So we would like to thank the FIP actually when the development goals came out. We actually took it into our stride and analyzed the fundamentals that FIP has brought in, the development goals that we have that have been put out by the FIP. And well, looking at this as a whole, I think after the latest election or the new council term for the MPS, our president, Encik Amrahi Buang, has decided and actually reached out to the council to say that why not we align all of this to actually whatever that's come out by the FIP. So instead of reinventing the wheel and let everybody do their own thing, why not we try and align everyone? And this is actually very important. Today's DG11, we're talking about impact outcomes. So basically what we are doing now is we're trying to see how we can make the MPS as an organization more impactful and have better outcomes for the profession. Okay, so we continue on with the document that FIP has, and also the sharing by the FIP and the team at the FIP supporting us. We actually take a look at the goals that have been mapped out and the importance in the 3 different areas of the fundamentals. And we took a great liking to the FIP development goals color wheel. Okay, so this is a very nice wheel, and this is what we did. I'm going to show you a very complicated slide. Please bear with me. So this is our mapping. So this is actually the map that we created from the development goals. And you can see around the color wheel, we have actually plotted where each of our chapters, and those they are filled in colors, and each of our committees. Okay, so just a sidetrack, or rather a reverse. Our committees are committees that are established for a function. Things like grants and awards or practice and ethics, whereas our chapters are, as I explained earlier, are for areas of interest, areas of practice, and the young pharmacist, for example. So after we plotted all our chapters on the wheel based on their functions and where their interest lies or where are they supposed to do, okay, we actually managed to identify 5 clusters that we need to focus on, which is the first cluster is pharmacy education. The second cluster is competency development. The third cluster is public engagement. The fourth cluster is service delivery and practice. And the last cluster is technology and development. So if we look at this diagram that we have mapped against our chapters, we now have a clearer picture on how the entire organization can move as a whole. Everybody does their own thing, but we are now united with a common direction based on all the development goals that have been set out by FIP. So I'm just going to zoom in now quickly into just a few examples to see how one chapter, which is actually my chapter, there's a health technology chapter, has been using this and how it relates back to the FIP development goals. So I'm just going to move example. Here, we are saying that you are using DG20 digital health. And as you can see, now we are identifying and prioritizing. So you can see the fundamental areas, which is the workforce and education, followed by practice and science. So this is actually from the FIP development goal. And what we did was, for every chapter, we assign a number of goals. Okay, it can be different goals. It can be more than 5, but generally we try to keep it within 5. So for the health technology, device and innovation chapter, which I am the chair, we look at pharmacy intelligence, which is what was presented earlier with the GPO, policy development with regards to the policy of digital health, access to medicines, which is and devices, which is very important during this COVID-19 period, DG20 digital health, and of course, sustainability in pharmacy, because pharmacy is moving, people are moving online, so pharmacy has to follow. So based on this framework of the developmental goals, we actually can identify, using the mechanisms that have been provided by the FIP, we can prioritize it, then we can generate an action plan leading to a KPI or a goal within each of our chapters. So in doing so, we are actually unifying everyone so that everyone is actually following the same direction. Okay, so the next steps we are taking now that we have actually just started, just in June this year, and we're actually moving towards the end of this year. We actually have some resources that have been done. We converted all the DG documents into an Excel file, where every chapter is given an Excel file, and this is actually loaded on a common drive hosted by the society. So then every chapter can go through the development goals that has been identified by the FIP. We can actually put what our outcomes we want for our chapters and which are the ones that we need to focus on. And in doing so, we can come up with an action plan. So then we can have an impact and producing outcomes for the pharmacist and the profession as a whole. So this is actually the next step we are taking that is going to start off, but we just started in December. And we're going to move on to next year. And this is actually my final slide. Is actually the roadmap. Okay, so one of the committees that we have is the strategy and planning committee. And right now, what we are going to go through is actually getting whatever framework that has already been identified and designed, and definitely with the support from FIP, we will actually be able to streamline this and put this into every society, every chapter, every committee, and into our states and even our association members in Sabah and Sarawak as well. Then for second and third quarter next year, we will get the engagement and feedback done, organizing a major strategic meeting where we are going to plan and in two stages, the short-term plan for 2023-2025. Then from 2025 to 2030, we will actually look at a more long-term plan, and the ultimate document we are looking at to come out with is what we call Pharmacy in Malaysia 2030. So that is actually where we are going towards, and that will happen at the fourth quarter next year, where we'll actually put everything into place into one document, and hopefully well, it won't be at Seville. Hopefully after Seville, Brisbane, we can actually have the chance to to actually present that document where we actually bring together all our chapters and all the aspirations of the profession in a document that is fundamentally built upon the building blocks of the FIP development goals. So, well, that's about it from me. Thank you for your patience. Back to you, Catherine.
Thanks, Jack. Seems like you're totally aligned with our Health Ministers Summit, which will be in Brisbane in 2023, please God. So, colleagues, you've heard from a STAR member organisation that has mapped and utilised and considered all the parts of the development goals and how they can be used across the organisation to better pharmacy in that country. And we would encourage you all to do similar. And we would be very interested to know what kinds of events we could host for you to do that with you. Next slide, please, team. So we thought we would just outline for you, as we move towards the end of the session, a little bit of a summary on what we've delivered. This digital programme of 21 events, setting the goals for the decade ahead, has comprised of many different goals themselves, culminating today in the 21st. We've also undertaken regional engagement and supported the mapping of country needs against the development goals. And you've just heard a great example there from Malaysia. We've undertaken regional roadmaps and priorities with our forums and with the member organisations in those regions. And we've collaborated with the members to translate the goals into languages, but also translate them into actions in their countries. So if we look at next year, 2022, taking a focus on the development goals, what will we deliver? Well, we'll provide our member organisations with a development goals status report for describing everything that we have found out this year and the plan that we're going to be delivering. We will be launching a dedicated microsite for the development goals so that it's a one-stop shop for you to be able to see not only the goals, but also all of the tools and supporting and mechanisms. We will be publishing a global roadmap, which takes us to 2030, that will be supported by regional action plans. And we will be, of course, supporting the translation of the development goals in other languages. So to learn more about the development goals, visit the FIP.org/FIP development goals site for a full list of the resources. You can download the full development goals, Transforming Global Pharmacy Handbook for a full overview of these goals, including their background, development, the approach we took, mechanisms, implementation, transformation. And you can also download the FIP DG's graphic kit for a collection of FIP DG's individual and group icons. These are available in English, Arabic, Chinese, Russian, Spanish, and French. And we have a selection of infographics and more. We also have an entire program of events and videos, recordings, and so much more for you to be able to use, as well as a translation of the Development Goals Handbook guide that you can use. Now, as you will know, FIP offers a varied digital events program on a wide range of topics, including subjects such as antimicrobial resistance, non-communicable diseases, vaccination, immunisation. This program, the FIP development goals, patient safety, the prevention agenda, self-care, and many more. To see all of our upcoming FIP digital events, visit our website on the events.fip.org. And then I'm going to draw the event to a close. So I'd just like all of the panelists to come on screen, if I may. And I'd like to thank you all for your participation, your generosity, your time. 100% couldn't do it without our members. I'd also like to thank all of the colleagues who have participated today. But I'd like to make a special mention of the team who've worked so hard to develop, design and deliver these events. Lena and Farah have done an amazing job in this regard. Mila has been so important in ensuring the smooth running of the events. Chris has been consistently at every event presenting the indicators. And our colleagues at FIP, we're a great team. We step up and step in to ensure you are all supported in any way. And this programme and the development goals themselves are key to that. Thanks so much to Lena, Farah, Mila, Chris, the entire team, and of course to you all for your support, your attendance and engagement. This is the final event in the 21 of 2021, but by no means is it the final event. We will be back. We will be back. We will need you in 2022. We wish you all the very best for the remainder of the year, and we look forward to seeing you next year. Take care, be safe, be well, and see you all soon.
Thank you. Thank you very much.